Coming up today, not dying from, but living with terminal brain cancer. A candid conversation with one of our beloved doctors who is making the most of every single day. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Doug Burton has been on both sides of the scalpel. He's one of the top spine surgeons in the country, and when he's not changing patients' lives, he's guiding the next generation of surgeons as the chair of the Department of Orthopedic Surgery at the University of Kansas Medical Center. But in 2023, he needed brain surgery, chemo, and radiation to treat glioblastoma, an aggressive cancer that carries a poor prognosis. Dr. Burton has been quite refreshingly candid about his journey with this deadly disease, and we are happy to have another chance to chat with him today. We'll get to that, but first, let's get to our morning rounds. Treating cancer and one day curing cancer relies, of course, on research, and we are proud to have some of that research happening here at the University of Kansas Cancer Center. Helping us underscore the importance of cancer research is Roy Jensen, Dr. Roy Jensen. He is a vice chancellor and the director of the KU Cancer Center. Dr. Jensen, always great to see you.
Welcome.
Good to see you. And for folks who are not familiar, what do we mean when we say cancer research?
Well, there's an entire spectrum of activity that covers, everything from basic science investigations that help us understand kind of the fundamental molecular aspects of cancer, all the way through to clinical trials where we're testing new agents that we hope will be even more efficacious against this disease.
Now, we interview a lot of oncologists here on this program. Besides physicians, who else is involved in research happening here?
Well, we've already mentioned the basic science folks who focus on really the fundamental aspects of what cancer is and trying to uncover mechanisms that we can exploit to develop new therapeutic approaches. And then, of course, the largest segment of people in our cancer center are the folks that work in our clinical trials office. And they're essential to carrying out clinical trials such that we can evaluate these therapies and determine whether or not they work against this disease.
Dr. Jensen, you have a podcast. It's called Bench to Bedside. Can you share an example of something that started at the research bench and then made its way to the patient bedside?
Sure. There's really a lot of examples in cancer research today, and I would say that this is one of the most exciting eras that I've ever witnessed in cancer research, and a big part of that is because over the last 15 to 20 years, we have slowly begun to understand how we can utilize the immune system to help us fight this disease. And Dr. Burton's case is certainly an example of that, but there's many others like immune checkpoint inhibitors and CAR T therapy, and as we'll soon hear, cancer vaccine therapy, which all three of those represent some of the most exciting new avenues for the treatment of cancer.
Dr. Jensen, we're doing a lot more research today than we were 10 or even 5 years ago. Can you quantify it for us?
Sure. So back in 2004, when we really got started with the designation process, we did about $14 million of total cancer research activity in the Cancer Center, and this year that figure is up around 85 million. So we have come a long, long way, and of course our clinical program has greatly expanded as well, from about 1,700 cancer patients now to, when you include the main campus, Olathe, and Liberty, it's closer to 8,000 new cancer patients every year.
There is a new cancer center building about to start construction. Dr. Jensen, what kind of research is going to be happening there?
Well, there will be a number of different types of research. In the main wing of the research wing of the building, it'll be primarily basic scientist focus there, but there will be clinical trials in our outpatient facility. In fact, we are really designing that facility to embrace new forms of immunotherapy, and in particular CAR T therapy.
Dr. Jensen, always great to have you with us. Thanks for making time for us.
Good to be here.
Well, at the desk with us today, Dr. Doug Burton. He joined us back on the program in 2023, and we talked about attitude, gratitude, and trying to live life in the present. Dr. Burton, we're so happy to have you here with us today.
It's good to be here.
It is good for you to be here. It's just always such a joy. One of my other favorites, Dr. Paul Camerata. Good to have you with us, too. You are the Clinical Service Chief of Neurosurgery here at the University of Kansas Health System. You operated on Dr. Burton more than 2 years ago. What is it like to be sitting here with not just your colleague, not just your patient, but most importantly, your dear friend?
It's wonderful. It's good. It's great to have him here with us.
Dr. Burton, let's just do a quick recap for those. As you explained on our previous episodes when you've been with us, around Thanksgiving of 2022, you had a headache.
Yes.
It lasted a couple of weeks. And then in early 2023, you got an MRI that found this tumor. Can you describe this headache that you had and maybe describe it as it would have maybe compared to it like a typical headache?
Well, I mean, I don't typically get headaches, and this one woke me up in the middle of the night, and it was probably the worst headache I'd ever had, but it went away with ibuprofen, so I thought, well, I'll be okay. And woke up in the morning and had a little headache, took some ibuprofen, I was fine, and went about my day, did my surgery, and then it was Thanksgiving, and kept working, but it never went away. And so I knew something was wrong. But you know, I was hoping it wasn't going to be something bad, you know.
Well, we're going to talk about treatment in just a moment and kind of get to that in just a bit, but I want to get to some good stuff first.
Yeah.
Do you mind?
Yeah, that's perfect.
Because you've hit some kind of cool milestones that I don't think you thought you were going to hit.
No.
And this is pretty special.
Yeah.
I saw you in the hallway the other day and you flipped out your cell phone, which I always like. That's what's cool nowadays. You can just go, hey, I got to show you something.
Yeah.
And you showed me this.
Yeah.
This is your daughter. Is this Caroline?
This is Caroline, yeah.
Walking your daughter down the aisle, is this something you thought you were going to be able to do a couple years ago?
No, I didn't think that was going to happen.
Big smile on your face. I'm sure a few tears. Tell me about this day.
Well, it was so special and you know, something that I never thought that I would see. And, you know, just as time went along and I was doing okay, I thought, you know, I think I'm going to make it, at least to Caroline's wedding. And probably it was an amazing day. And you know, the father-daughter dance, and then Caroline grabbed the mic and she insisted, you know, told everyone about what was going on. Many of them knew, and then I did a father-daughter dance with my other daughter, and there wasn't a dry eye in the house. It was amazing.
I would imagine
it was
not.
Amazing.
But there might be another wedding in the works, I heard. Let's show that picture, because you got another one on the way.
So this is my younger daughter, and she was not shortly after Caroline got married. Her fiance Cooper proposed to her, so we're excited for another wedding here in November.
Well, let's get her down the aisle as well.
Absolutely.
And then your son recently graduated college and is going to be staying close to home.
Yeah,
is that what I understand?
He's been working here in town with the local company Murphy Hoffman, and he's doing great. I
would imagine that, you know, when we think of life, Dr. Camerata, I'm sure, you know, you could probably attest to this too. You know, you think of these big milestones. Those are so great to hit. And then something like this happens. And then I would imagine it's those little moments that start to be a big deal, right?
Oh, for sure. I think that, you know, that's one of the things that, you know, I've learned through all this is to be grateful for those little moments. You know, I think a lot of times we focus on the big moments. It's the little moments that bring us that joy on a daily basis, and we've just got to take the time to stop and appreciate them.
And Dr. Camerata, when you get to celebrate those with patients, it's a big deal, especially when a patient's a friend.
It sure is. I look forward to seeing it all the time, and you know, the journey that these folks take is incredible, because they get hit with the news that they have a brain cancer, and they don't know how much time they're going to have left, and so it means savoring these little moments, you know, month by month, hopefully year by year.
Well, I prefer talking about weddings and all that fun stuff, but let's talk about glioblastoma, as we must. It's called GBM also. We know that this carries a poor prognosis. Many might remember the late Senators Ted Kennedy, John McCain, who faced the same diagnosis recently. Singer Michael Bolton has been talking about this, having some strange symptoms when he was diagnosed with it. Dr. Camerata, what do you tell patients when they're first diagnosed with this? These must be tough conversations.
They are, and much of what people hear about glioblastoma is based on the past. In other words, what we know now is glioblastoma is not one entity. What we used to think was the same tumor is many different tumors. They just look the same under a microscope when a pathologist is looking at it. So I first tell them, look, the sky's the limit. We're going for a cure here. I know that the odds don't look good, but we'll figure out what kind of tumor you have and find the right treatment for it.
Can you describe the surgery that you performed on Dr. Burton a couple of years ago? What was the goal in that surgery?
Yeah, so when Doug presented, he had a primary area of the tumor that was clearly where it started. But in glioblastoma, or similar tumors, it doesn't stay put in that one area. It spreads throughout the brain. Ultimately, it can spread to both sides of the brain, and by the time his was discovered, it had already spread well beyond this little, relatively small area in the back part of his brain that was clear that it started from. And so we knew we weren't going to be able to make his MRI look normal by taking every little bit of tumor out. So we concentrated on getting rid of the biggest portion of it, figuring out what it was, and then finding the appropriate treatment.
So great to have a surgeon like Dr. Camerata close to home, or down the hall, as we should say. But you also traveled to Germany because of your glioblastoma. Where did you go? What did you do there?
Yeah, so I, after surgery, looked at what my options were, and most of them didn't sound very good. But I was introduced to a treatment that existed down in the southwest part of Germany in Tübingen that was an immunotherapy treatment. And there's a geneticist there who does DNA sequencing, and is her kind of passion project is treating glioblastoma with a vaccine, basically. And so we sent my tumor to them and my regular normal cells, and she sequenced the DNA in both my tumor and my normal cells, identified self and just from non-self the tumor, and then created a vaccine against that tumor. And I've been going there since September of 23, receiving vaccinations for it.
So what is the status of the cancer? What have the recent scans shown? Will you continue to go back? Yeah,
so my tumor's been stable since November of 2023. I get an MRI every 2 months. I've got one coming up here in a few days. And so for almost a year and a half now, it's been stable. I wouldn't say it's necessarily gone away, but it hasn't gotten bigger. And my symptoms are, unchanged. I'm doing fine, so I'm pretty grateful. And it's what we all have. We only live day by day. Nobody's guaranteed tomorrow.
We all do, right?
Yep, that's right.
Dr. Camerata, are you able to say why Dr. Burton has survived this long while others with the same diagnosis have not?
Yeah, well, as I mentioned, not all glioblastomas are the same. Different ones are different. We used to think, back in the day when I was young, I would operate on, let's say in a year, 50 people with glioblastoma, and, 5 of them would be alive 3 years later. And I think, oh gosh, why did those 5 make it? I was a good surgeon on those 5, not so good on the other. No, it was a different tumor, and so I'm hopeful. Doug, obviously, the immunotherapy has played a huge role. The tumor has, at one point shrunk, and then it's been stable for a year and a half. And so, the newer treatments that are available is what is responsible for, I think, Doug's survival, and his grit and the power of prayer and friends and family and all of that.
Yeah, I see you. I'm always hearing you outside my door when you walk outside.
I have a loud
You're
voice.
loud, and you're always down the hall, and I look down there, and it's you, like, laughing and having. You just look great, and you're doing great.
Thank you.
It's good to see you. Yeah, you look, it's just nice. It's just really nice. Okay. Please feel free to ask questions. You can ask questions to both of our doctors right here on the program. They'll answer any of your questions. Just use the chat on YouTube or Facebook. You can email the Medical News Network. That information is right there on your screen. Well, progress relies on research, and brain cancer research relies on events like Head for the Cure 5K. The fundraiser run started more than 20 years ago right here in Kansas City and has expanded in a big, big way. Let's bring in the organizer, Matt Anthony. Good morning, Matt. How are you?
Good morning. Great to be here.
Well, great to have you. How many participants in your first event, and then how many has Head for the Cure, and how has it grown over the years?
Well, thank you again for having me. It's great to see Dr. Camarada, Dr. Burton. I've become friends with them over the years. It's been an honor for sure. So 2003, we had 300 people raise $25,000 and thought we crushed it. And since then, well, in Kansas City alone, we've had almost 90,000 participants, raised about $8 million. We're now the largest and longest running charity 5K in the metro. So no 5K that gives money back. Charity has been around longer, and last year we had over 6,000 participants. So for a relatively rare cancer, to have that kind of support from the community is pretty remarkable. And then take that, we operate Head for the Cure now in 26 cities, coast to coast, from Portland to New York City, and we've had about 330,000 people participate in our 5Ks and raised over $30 million. So what started as an honor for my brother, who was facing a glioblastoma at age 35 and was a runner, thought we should start this. We've carried it forward and in a pretty remarkable way, thanks to an amazing community, thanks to great connections between patients and their medical partners.
Fantastic work that you have done over the years. And this is, of course, a fundraiser for brain cancer research. Matt, where does the money go?
Sure. Yeah, so a good bit of it goes right back to the KU Cancer Center, the Brain Tumor Clinic that Dr. Jensen spoke of earlier. And I should say, too, Dr. Jensen, a shout out to him. So I've known Dr. Jensen for many years, too. He actually has run in the event 21 out of 22 years, and he usually medals in his age group. His age group has evolved over that time. But Dr. Jensen is an amazing partner, and the team, Dr. Camarada, Dr. Rodriguez, Dr. Tunser, the brain docs have been great supporters. So about half of our net funds raised from the Kansas City event are plowed right back to KU Cancer Center to the Brain Tumor Clinic. And we have some special programs we're pursuing to improve the research path forward and hopefully outcomes. We do that in each of the cities that we support. We are very grassroots, so we raise money locally, we leave money locally, and we also have a network of academic cancer centers called the Brain Tumor Trials Collaborative, which combines in a multi-center way the resources of centers across the country. And then we operate our own advocacy and education programs. A tool called Brains for the Cure. We do support work. We have a podcast. We have a number of educational efforts that support this community. And it really comes down to three things. We're raising awareness for a disease that needs attention, and awareness creates the opportunity for fundraising because it is under-researched. Why? Because it's underfunded. But mostly through all of that is we're igniting hope. We bring together this community. Our best program is our event itself, and Dr. Burton can speak to that it is truly the solidarity of others who are facing something that is lonely. And Head for the Cure is the embodiment of you're not alone. Both the patients, but more broadly, their caregiving community. So Dr. Burton can speak of the support that Burton Strong receives the first 2 years. That's a very large team, and this is the throwdown, Doug, to build that team again bigger this year.
Yeah, I know. We saw quite the crowd at the first Head for the Cure race after your diagnosis, Dr. Burton. How many people were on team, Burton? Tell us about this.
I think it was probably about 450 or so that first year. We weren't the biggest team. We were the second biggest team, but
We'll take it.
It was a strong showing, I
Burton
think.
strong. I like
Yeah.
that.
It
Dr.
became
Camerata?
quite a competition, actually, between Burton Strong and Team Little Owl, the team that has been operating for about 12 years following the passing of Allie Fisher from a DIPG tumor, childhood brain tumor. So but the friendly competition for sure.
That's good. Yeah, you did good. You did good. Dr. Camerata, what's it been like, just on a community level, just getting to know folks like Matt, meeting other people just affected by brain cancer, knowing what he's doing, and just bringing everybody together, just talking about, like you said, a rare cancer like this, and knowing that this money and these funds are being raised and this awareness is being raised.
It's important, especially what Matt does. I mean, I've known Matt back since his brother was ill many years ago, and as he said, it's almost an orphan disease. There's so few brain tumors, only 25,000 every year in this country. And so it's great to get together. You've been around long enough, you see people. I was at the ball game last night, somebody sitting next to me, you know, I've run in the race a few times. I'm having back surgery this week, so I can't really, this year's gonna be a little tough, but it's great seeing people and seeing people with hope, you know, after all these years.
For sure. Hey, Matt, just thanks for everything that you do to raise awareness, to raise money, and of course, just build that sense of community here in our area. Just any final thoughts before we let you go?
No, well, again, I thank you, Paul, for mentioning. So when my brother, he moved back to Kansas City from Dallas, and I met Paul. Our kids were in school together, and through other friends, and I asked Paul if he would look after my brother, and he did in those last months. So I'm forever grateful to Dr. Camerata for that as well. You know, no, I think that the thoughts are our event, if you will, and that's what it is really all about community. And it is a celebration. It's a party. We live music, lots of food, kids zone, all kinds of activities. And I want to thank KU Cancer Center as well. They're both the sponsor of the event, but also the beneficiary. So I think I would kind of echo what Dr. Burton said about the importance of community, the importance of staying positive. And doesn't mean every day's cheery, but I think that Head for the Cure and other programs like it are all about living, and that's really what Head for the Cure is about. We bring people together to celebrate life, and when you have the benefit of community, people by your side that are embracing you, figuratively and literally, it has unmatched energy. And so if you're wondering what you can do for somebody facing a difficult disease, we rely on our doctors and their large teams to push the science forward to give us the best chance. But those of us who surround the people in our lives that are most important, the most important thing you can do for them is show up. You know, don't ask them what you can do to help them, just show up for them. And the power of that is unmatched, and that's really the very centerpiece of what we do at Head for the Cure, is just provide a vessel so people can show up for the people in their lives that are facing something unexpected and very difficult, and you'll make it easier for them.
Great message this morning, Matt. Thank you so much. Thanks for being with us, and thanks for all you do.
Thank you. Good to see you guys.
Good to see you, Matt.
Dr. Burton, I hope you're feeling the love around here everywhere you go, but I have to wonder what it's like to see this, yourself engraved on a plaque that now hangs inside operating room 36. What is this like?
Well,
Because this was kind of a little surprise.
yeah,
for you.
pretty humbling. Pretty humbling. You know, and Paul knows it's always a team in the OR. You know, everyone has to contribute, and we had a great team, and it was fantastic working down there. I miss it, but you know, life evolves, and we have new focuses, we have new purposes in our life, and that's kind of where I'm at now.
Because you're still here, but you're not operating anymore because you had some side effects. Tell us about that.
Yeah, you know, I had my standard therapy after the surgery, and the surgery went great. I was, you know, feeling good. I went back to work probably 4 weeks after my brain surgery, just seeing patients. But then I had what looked like a recurrence pretty early on, and so I had some stereotactic radiosurgery, and probably about, I guess it was probably 2 months after that, I started getting some problems with my right hand. I couldn't type anymore, and then a little bit of problem in my right foot. So it's nothing really big, but you're not going to operate with that, that's for sure.
Well, I have to ask you, because I just have to ask you,
Yeah.
under these circumstances, what's next? Because there's more next coming for you.
Yeah, well, I mean, you know, every day is living. So that's the big thing, is you've got to value every day of life. I'm now seeing patients 3 days a week instead of 2, which, you know, I tell Paul, there's no way I ever thought I'd want to do 3 days a week at clinic, but I really love it now. So that's great, and we're doing some things in orthopedics that I think are exciting, and you know, and I'm trying to stay as active as I can to try to bring the treatment that I had, whatever I can do to bring it over here. You know, I think that's great that I'm doing well, but I want to see that available to all the people that I know here in the United States that can't travel to Europe to get treatment.
I want to get to some questions from our viewers this morning. Stuart says, I read that some tumors can grow their own blood supply. What does that mean?
Well, tumors, tumors grow blood supply. They secrete substances that create new blood vessels into them. And one of the drugs that we use to treat glioblastoma in its advanced stages does just that. It cuts off the blood supply to the tumors, and in doing so, retards their growth. Doesn't really eliminate the tumors, shrinks them a little bit, and of course when you stop that medicine, many times the tumors will regrow, so that's not a permanent fix in this case.
Okay,
Yeah.
question from Lynn. What current treatment options are available to prolong survival in patients with glioblastoma?
So one of them is this medicine that decreases the blood vessel supply to the tumors. You know, we have radiation. We have, there is a recent medicine that came out for lower grade gliomas that has been approved it was in a multi-center international trial, and the trial was stopped early because the medicine helped so much, and so it's being used now to treat lower grade tumors, not glioblastoma, but a step or so below that. But that's giving us encouragement that these drugs are in development, and there might be something that comes around that cures some of these glioblastomas.
Does exercise, do you encourage patients to exercise to help prevent recurrence of disease?
We encourage exercise. Whether it prevents recurrence or not is
Sure.
another story, yeah.
So we have some good comments here. Noreen says, so glad to hear from these two exceptional physicians this morning. Noreen also asking if the immunotherapy, I think that you were speaking of in Germany, is that also available here in the U.S.?
No, it's not available here in the U.S. right now. The hope is that at some point it will be. I am getting another type of immunotherapy that Dr. Jensen talked about, Keytruda, which is a checkpoint inhibitor, as an adjunct to the immunotherapy that I get in Germany. So I'm getting the Keytruda here at KU as, you know, as kind of the second weapon against the tumor in addition to the vaccine.
All right, Jeremy says, I imagine that getting news like this reframes how you look at your life. If it's not too intrusive, would you mind sharing some things that have changed in how you view, how you viewed or choose to use the time that you have left?
Well, I'll tell you, the first thing is that I dove into my faith in a way that I'd never imagined before. And I would say that's probably the most important thing that I did. And it's reshaped, you know, how I live my life every day, that I focus on that. And when I do that and start my day that way, I'm a better person and I'm happier. And so it works for me. I don't know that it works for everybody, but it seems to have worked for quite a while. So I definitely recommend that. And then, it's practicing your gratitude. I think it's easy to be depressed and you feel like, why me? Why is this happening to me? It turns out we're all going to die. Every one of us. No one gets out of here alive. And so how are you going to live? And if you live with gratitude, that's going to heighten the joy that you're going to have in life. And that's what I've found. And that's been my mantra from early on in this journey.
Well, and Paula had a comment just saying what an amazing patient story, asking if you could provide advice for those who have had a difficult diagnosis.
Yeah, well, that's it. I mean, your spirituality, your faith, your gratitude, I think that's the place to start, because that's what you can control. I think one of the things that I learned early on is that patients, one of the things that bothered them the most, coming from a caregiver perspective, is patients lose control when they're sick, and they can't stand that. And boy, did I experience that, because I was maybe, if you read the plaque, I'm a little bit of a control freak.
No.
You're right. So, but what can you control? Well, you can control that. I can control, my gratitude. I can control my spirituality. I can do that. And what happens, happens. But boy, that made a big difference for me.
Getting some good questions here. Hold on, I've got to get to a good one here. Anne says, I don't know if you remember Anne. Anne says, Dr. Burton gave my mother her life back through a successful back surgery. You certainly have done this for so many. I'm grateful that you're receiving the same incredible support and care.
Thank you, Anne.
That's from Anne Palmer. Wendy says, I thought you didn't grade glioblastomas anymore.
Yeah, so by definition, a glioblastoma is something called a grade 4 tumor, kind of the end of the line. But as I mentioned, 15 years ago, we would take the tumor out. A pathologist would look at the slides, and they say, oh, this looks like a glioblastoma. Well, now we take those slides and we take the cells and test them genetically. And so we find out this is a glioblastoma with this mutation. This is another one with this mutation, et cetera. So in that sense, we don't really grade them, but we say these glioblastomas seem to have a better prognosis than these glioblastomas. So we can stratify them based on their genetic modifications.
Wendy wants to know what helps with anticipatory grief.
Well, the first thing I would suggest is don't pre-grieve. That's the key, because again, we're all going to die, but we're not grieving every day that we're going to die. So it's hard to do, and sometimes you start going down that rabbit hole, but it's dark. And so for me, it's been focusing daily on what I'm grateful for, because I can't control what's going to happen. And that was one of the messages I tried to give to all my kids. I'm like, we're living now. Let's not be sad now. We can be sad when I'm dead, but let's be happy now. We're alive.
Does it make you comfortable or uncomfortable when people ask you these questions? Because every time you're on, people really feel comfortable asking you this, and I appreciate that you're willing to be so open about it.
I mean, I think that's why I'm still here.
I think so too.
And
we really appreciate that. We really appreciate you talking about it. But we like that you are still alive to keep coming back and talking about it.
I like it too.
I really like that. We like that you keep coming back. We like it. Dr. Camerata, what do you think the biggest takeaway is from this really incredible story? I mean, just having Dr. Burton around and just being here with us all the time and sharing his story over and over again.
Yeah, I mean, don't lose hope. I think maintain a positive attitude. Don't lose hope. We have treatments coming down the line, all the time. There are improvements. I see people, and I'm up front with them at the beginning and say, My job and the job of all of the specialists here is to keep you going long enough until somebody finds a cure for this disease and you get it.
Question from Wendy. Does every tumor get saved and frozen to FDA standards for future studies?
So, you know, it depends. Every tumor is saved in a sense and frozen, and we can go back and check the genetic makeup of the tumor. But every tumor is not frozen to the degree that Dr. Burton's was and some other tumors are, where it could be used on a vaccine in the near future. In order to do that, it has to be stared and it has to be saved in very special circumstances, and we kind of have to know up front that this may be a possibility.
Interesting. I did not know that.
Yeah.
I will ask you once again.
Yeah.
What's the big takeaway from your story? What do you want people to know?
Yeah, just live life, be grateful for life, and don't give up. I mean, when you give up, it's going to be over pretty soon. So stay faithful and hopeful, and love the people around you, love the people in your community, love your God, and you'll see what's going to happen. Nobody knows.
Another wedding in November, is that right?
Another wedding in November.
All right, and then you're coming back.
Then I'll be back.
All right.
We'll talk about it.
I want my Burton fist bump.
I'll bring pictures.
Bring pictures.
All right.
All right. I love it.
Sounds good.
All right, guys. Thanks so much for being here. Good to see you. All right. Thanks to our viewers. Thanks for all your great comments and your questions today. And we'll see you back here tomorrow.
Music can move us, but does it have the power to heal us? I'm Alexis Del Cid. On the next Open Mics with Dr. Stites, meet the musician/neuroscientist studying music's effects on breathing, pain, and more. We'll show you the science trying to turn music to medicine. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.